Dear parents and friends, welcome to our channel Child Health Matters. My name is Pawan Sharma and I'm a pediatrician. Let us talk about childhood asthma today. I strongly believe that educating ourselves with regards to our health always helps in taking better care of ourselves. And that is why it is important that we learn what are the right things and what are the things we should not be doing in each problems we face. This video is going to be a little bit longer, maybe about 13 to 15 minutes, but I think and I believe that each and every slide is very important for us to understand what is asthma. Not just childhood, I think anybody who suffers from asthma should get help from what I'm going to talk about today. Thank you so much for your valuable time in advance. When we talk about childhood asthma or asthma in children or irrespective asthma at any age group, learning and self care is so vital and so important for the better health and well being of each of the person who is suffering from asthma. It always helps us to understand when we know the problem, what is the problem, and what are the likely solutions behind it. So, here basically we are going to discuss what is asthma and how does the treatment work in asthma, and apart from actual medical treatment, what other measures are important when we try to deal with asthma. When we talk about the severity or seriousness of the problem, I'm not going to go into the details of the number, but it is important to note that the asthma is one of the commonest lung problem in children and probably all other age group outside the infections of the lung, and it is responsible for significant effect on the health and well-being of children, including significant number of deaths. And to be noted that there is gradual increase in number of patients, number of children suffering from asthma for all the various reasons. If unfortunately any member of your family is suffering from asthma, you will probably agree with me with the effect on the life and family of the person who has got asthma. You can see that it causes sleep disturbance, tiredness, significant effect on education. They can't even do their normal activities, and it is a social stigma in a way, a significant financial burden on the family. And then, if the attack is severe, then admission to hospital and it can be life threatening as well. Honestly, I prefer things to be as simple and as basic as possible to try to understand what a problem could be. So, if you look at asthma, then look at the lungs. It is primarily a disease of a lung. Here you can see a picture where a person has, or we all have two lungs, and there are breathing pipes which starts from the nose actually and then goes down into the lungs where exchange of gases happen. So we take oxygen and give out carbon dioxide. But if for any reason there is problem at any level, then it is going to affect the flow of air or gases to the lungs and in event have a problem for us. So, what happens in asthma? For some reason, there is a trigger or irritation of the breathing pipes. Now, with that irritation, few things happens. Number one, there is constriction of the muscles. Number two, there is a swelling of the wall of the breathing pipe. And number three, there are secretions. So if you look at this picture on the left hand side, which is a nice and clean breathing pipe, there is no swelling, there are no secretions, and the muscles, they are not constricted. While on the right hand side, there is a picture. You can see the muscles are constricted, tightening of the lumen has happened because of that, and then there is a swelling of the wall. The secretions actually are not shown in this picture, but you can see that there is a significant narrowing of the breathing pipe, affecting the flow of the air which is needed by us. Very rightly so. Every parent's first concern or question is that does their child have an asthma? The common usual symptoms are dry chesty cough, breathing difficulty or shortness of breath, the wheezing sound which comes from the chest, and then sometimes the children complain that their chest is tight. Practically every asthma symptom has a trigger factor, but it is not necessary that we are able to identify that or we know what is a particular trigger for a particular person. But as you can see on the sides, there are some of the common trigger factors for asthma. The reason we need to know trigger factor, because if we are able to avoid them, it will help us to significantly control the asthma symptoms for a particular child. Just like trigger factors, there could be some risk factors which makes asthma more worse. And it is important to know about that as well, because if possible, we can take steps to avoid them or try to correct them. Now, how do you diagnose asthma? I think it could be simple from the symptoms I have already mentioned earlier, but it's primarily a clinician's job to diagnose. Most important is that there is no specific test, and at times there can be difficulties in arriving at a diagnosis of asthma, and a specialist probably will be able to help with that. Before we talk about treatment of asthma, we would like to clearly mention that this is not an advice for your symptoms or your diagnosis for treatment. Please do seek professional advice for your health. Now, the treatment of asthma is broadly divided into two categories. One is what we call as a preventer, or the medicines which are used to prevent the severity and frequency of the asthma symptoms. And the other is called as a reliever treatment, where the medicine is used to help the breathing pipes to open up to help with the breathing. So let us go back to the picture which we have seen initially what happens in asthma. So as you can see, there are constricted muscles on the right hand side. Now, the reliever medications, they act on these muscles to help them to open up. And the steroids, which are used as either given by mouth or as an inhaler, they help to reduce the swelling. One thing which I strongly recommend to anybody with asthma, irrespective of the age group, is use of inhaler with a spacer for their management. But please do seek medical or professional advice. Now, the medicines, we understand that they can be delivered to lungs as well as the breathing pipes, and that's how the concept of inhaler and nebulizers came in. Because it is directly delivered to the lungs, only small quantities are needed, and that's why they have a less side effects and they are more effective. There are lots of concept about that patients get habituated or it is addictive. There is nothing like that, and there is no evidence, there is no proof that the use of inhaler or a spacer is addictive in any way. Sorry about the repetition, but I think it is really important to use the inhaler with the spacer, simply because the medicines directly go to the lungs and the breathing pipes. There is adequate delivery to the lungs, and then only small doses are needed. And of course, the side effects are much less as compared to taken by mouth or injections. You can clearly see the difference of the medications delivered to the lungs with different devices. Like the simple inhaler, directly using only 10% it goes into the lungs or the breathing pipes. Rest get deposited in the back of mouth onto your tongue, and then they're likely to have effects like having thrush. The second one is unfortunately has to be used in some children who cannot use the one which is in the third picture, but again it delivers somewhere between 25 to 60% or 50%. And the third one is the best option, which delivers more than 50% of medication to our lungs. So these are some of the devices available to use for the inhalers. The first two are useful for children who are less than 3 or 4 year old, while the clear one is called as a volumatic, and there's a blue aero chamber which is written on it. They both are practically similar, and they can be used by older children and whosoever is able to use their mouth to breathe in and out of the device. This is just a suggestion that you can visit this website to find more information about how to use the spacers and aero chambers in asthma. There should not be any doubt that every child or a person with asthma should have their own asthma plan, because that helps them to have a better control of their asthma symptoms and avoid any problems with severity of the asthma. The website given here is just a suggestion. You can visit that and find more information about it. Asthma management of every child is practically a teamwork between parents, health professional, and the schools. We should all aim that all our children with asthma should have absolutely normal life. Things not to do when someone has asthma or your child has asthma are equally important. Number one, smoking or vaping, they both are equally bad. Number two, use of nebulizers. Now, I personally do not recommend use of nebulizers at home because it carries its own risks. But I would suggest that please take health professional advice with regards to your own child. Now, the use of inhaler as a direct without any spacer should not be done because it has practically no value in treatment. Okay, there are lots of cough syrups available over the counter and sometimes on prescription, but there is no role of cough syrup in management of asthma. And please do not forget to follow the asthma plan. Okay. Other important thing is the role of exercise. Exercise are very important. Please do not stop because you have asthma. Take treatment as per advice from your health professional and continue to do your exercises. Asthma management is a joint responsibility and teamwork. And that is why we need to educate ourselves, including health professionals, educate our children, tell them about asthma, what it is, and how it can be controlled. Okay. Support other families because not everybody is lucky and not everybody will know what exactly happens. Make our schools asthma friendly so that the teachers and the school workers can continue to support these children to have a normal life. And do not forget asthma plan. Have asthma plan for your children, and as well as anyone with asthma should have their own plan. This is a peak flow meter, primarily used to understand the severity of chest symptoms or asthma symptoms, used by many hospital and clinics. I personally do not use for my personal reason because I find it quite variable depending on the age of the patient, depending on their capacity, and then it does have its own limitations. Thank you so much for your valuable time to listen and watch this video very patiently. If you liked it and if you think that it is useful, please do not forget to like it and share it to anyone who you think it will be useful. And more importantly, your comments and questions will be highly appreciated. Thank you so much once again.